So what were the implications of not being able to get in the State Medical Association?
You had to get in one of the requirements for hospital privileges at that time was to have a membership in your local medical society, which was Central Medical Society. You had to have the signatures of 3 physicians. And until 1965, we were able to locate 3 physicians who finally signed on, and we could have full hospital privileges. And that was true all over the state. Of course, here again, that's where Title VI of the Civil Rights Act came in and eliminated that, because that ceased to be a requirement. Then after that, physicians could have privileges based on credentialization.
So as I understand it, you and your colleagues who were qualified to get into medical school,
there were 3 of us here in Jackson,
were given scholarships as enticements to go to one of the 2 black medical schools rather than going to our school, Ole Miss.
Ole Miss, that's correct.
And then required to come back after you had your medical degree and a minimum of a year of postgraduate training, which you couldn't get here either because they weren't taking blacks. You were required to come back and work here for 5 years, but then you couldn't get hospital privileges.
That's correct.
Which meant all you could do was outpatient medicine. Now, do I have that right?
You have that basically right. And this is very interesting, too. I mentioned to you earlier that Mississippi, in whatever that quagmire that was taking place going on, ceased to recognize that there was at least 4 black hospitals operating in this state, 2 in Mount Bio, 1 in Yazoo City, and 1 here in Jackson on the campus of Jackson State. In 1963, the Mississippi Hospital Commission said that we did not meet minimum standards to operate a hospital. And yet there was no provision to provide access for us at the major hospitals such as St. Dominic's Baptist or University.
Now, the other thing that I haven't heard you say anything about yet is Tougaloo, the role that Tougaloo, I was sort of surprised you as a Tougaloo graduate mentioned Jackson State and said nothing about Tougaloo in the whole discussion. Tougaloo, you told me that Tougaloo was a safe haven for civil rights advocates forever.
Well, Tougaloo, beginning, I guess, in 1869, and as many other historical black institutions. But somehow Tougaloo misclosure by that. That was actually a law introduced into the Mississippi legislature to close Tougaloo. But in addition to Tougaloo maintaining academic excellence as one of the small private universities, regardless of race in this country, it was also the school of academic freedom for Mississippi, where all the leaders of the palace guards who were talking about and needing for change came to Mississippi to express their ideas.
Now, Dr. Dittmer,
it was also the place that I could take the doctors and other health personnel who came down here to volunteer to at least suggest that Mississippi was civilized.
Now, Dr. Dittmer, when I was reading your bio, I was surprised to hear that you were a dean at Tougaloo, right?
Yes.
How in the world did that happen?
Well, it happened because, it's a long story, but our dean's house was bombed by the Ku Klux Klan shortly after we got there in the fall of 1967. I was new to campus. I hadn't joined any faculty faction, so the president asked me if I would step in. Now, Tougaloo had a tradition of white presidents and black deans. George Owens was our first black president, so he wanted to continue the tradition. He had 2 white deans, and so when the white dean was driven out of town, why, I rather foolishly said I would do that, as long as we didn't have to live in the dean's house that was bombed.
So you were already in Jackson for scholarship reasons. That's when you got all this information to write all these books. Is that
Well,
right?
no, I was at Tougaloo, you know, to teach, and it was only later on that I got to know civil rights workers, got to know Dr. Smith, and began to do research.
Well, why did a white man come to an all-black university in a place like Jackson?
Well,
what was
probably
that?
for the same reason that the 1,000 volunteers came down in the summer of 1964. We wanted to do something to push the country a little bit forward. I was not an activist. I felt that by teaching in a black college, I could probably do some good. We came down for a year or two, and we stayed for 12.
Well, let me tell you something else that's very funny, Rick. John helped in helping one of our local hospitals pass the integration test. He got sick and had to go into a hospital, and he was one of the few white men that in that early date that had biracial room occupancy.
Is that right?
Bob says I integrated Baptist Hospital.
That's a good thing.
You helped to integrate.
You asked about optimism earlier, and I think just listening to both Drs. Dittmer and Smith recount everything that happened, there's nothing but optimism that you can feel. We have University of Mississippi that has increased their enrollment of African American, not only medical students, dentists, pharmacists, nurses. The fact that I, as an African American woman, am an associate vice chancellor at UMC, the fact that people live in all parts of the state and in Jackson, there's nothing but progress that we have to look at. And while it may have taken us a little bit longer, we are on the trajectory of improvement. And while we always have the state of the nation looking at Mississippi for negative reasons, I think they should continue to look at us for positive growth as well.
I would agree.